Yes, welcome back to Spotlight. I'm here with Miss Nyasha Penn. She is the assistant manager in the medical department of Nagico, and the managing director, Mr. Shan Mohammed. Welcome to Spotlight.
Thank you
Thank you
very
for having
much.
us.
It's good to see you. This is a important night, I think, that a, an insurance company is, you know, talking about what their role can be in the in conjunction with the national health insurance program. And I'm really happy, Sean, that you decided to come by and, take the lead in
Thank you.
saying what Nagico, what role Nagico plans to play. And we were just looking at the commercials, and Nagico's name, of course, popped up as a sponsor. And I think the last time you were had made mention that the good corporate citizenship of Nagico Insurances, that there's a lot of events, particularly when it comes to young people and culture, that Nagico participate in, make either human resources or financial resources available so those endeavors and events could be successful. And I kind of thought of your relationship and what perhaps could become a partnership between Nagico and NHI as another one of those contributions to the community, and because no one else has come forward, but apparently you've seen a way where you can fit in, Nagico can fit in, with the national health insurance and make coverage even more affordable, increase coverage even
Yes.
more affordable to the population. So I'd just like to talk about your perspective on and Nagico, what you see Nagico's role is in relationship with NHI.
Yeah. Well, our view is that I think it's commendable that the government has embarked on a national health insurance program for its citizens. I think that every government has a responsibility to its people and residents to provide affordable health care. We see our role as one of partnership. It is, the NHI is here. Nagico has been working very, very hard to develop a plan, a schedule of benefits that complements what the NHI is offering. In simple terms, Nagico policy is intended to cover over and above what NHI will provide coverage for and to provide access to overseas health care. So it's more like a major medical policy, but it also would provide for some level of claims from BVI. For example, if a particular illness is covered up to a limit of $10,000 on NHI, and Nagico might be prepared to cover the remaining difference of, let's say, $40,000. So we have done so. We are aware of the cost factor, and I'm happy to say and share with you that we have arrived at a premium range that we believe makes it very affordable for even low-income employees, all the way to the top. So we have been very, very busy. Ms. Penn has been very busy for the last month, I would say, making presentations. A lot of people, to some degree, are sort of watching and waiting to see what's going to happen. There have been some delays, as you know, with the NHI. It was going to come. I think finally we are all accepting it's going to be here in January, and we are ready to offer our plans. So I think it complements what is going to be offered by the National Health Insurance Scheme.
That's great. And what areas you see Nagico partnering with NHI? What are some of the areas you think that you could offer a package or a policy that supplements, augments what persons
I know Ms. Penn would have the jump on me in this one, but broadly speaking, and I'm sure she will add to what I say, is that we have looked at what the national health insurance coverage limits are and what they're going to provide in coverage overall. So we have designed something that is exactly over and above that. And we know that there was, people wanted to be certain that they would have more access to a more extensive network in the U.S. than perhaps NHI can offer. And, the Nagico policy has always been in conjunction with United Healthcare out of the United States, which is ranked either 1 or 2 in the U.S. So I think having the Nagico supplementary policy allows you access to the best hospitals as well in the U.S. So where there might be, if there are any sort of, perhaps, any limitations, we are able to provide for those eventualities. So I think that overall, if you add both, if you put them together, you possibly will get one. Exactly what you had before if you put our policy alongside what NHI will cover.
Yeah. Now that's quite interesting to me, because it sounds like Nagico is putting the population, the community, in a position to be able to afford all the coverage that is needed. So, for example, if I'm paying $150 a month for NHI, and I need a specific type of coverage for for illness I might have, I might be able to get that from Nagico, get a policy that covers that from Nagico that I can afford as a middle income person.
Yeah.
So that opens that opens up an opportunity from the lowest, let's say the poorest to the richest, to be able to afford the total coverage that they would need.
We sort of follow the basic concept of insurance. If the more people we insure, is the more sustainable the supplementary plan is. Just like NHI, as is compulsory,
right.
and it's made compulsory simply because you need the entire population to contribute to make it work. It is the same premises on which we have priced our policy. So that too depends on a fairly large percentage of persons taking up the opportunities. But we did look at the difference, and we did try as hard as possible to make it within reach. And I think that having a look at the group and the feedback we've gotten from many of our group policyholders, and there's some early indications that it's doable.
Mm-hmm. So you're quite satisfied with the market, some market responses.
Yes, there's some early indications that
to your policy.
There's interest, certainly interest.
Okay, I want to talk a little bit about those policies now with you, Ms. Penn, because we only have a short time. I have a packed show again tonight. Coming to the end of the year, it seems like everybody wants to get on. Now you have a spectrum of policies. How are your policies developed in terms of costs and coverage, benefit? I should say benefits package.
Okay. All right, we have 2 basic categories. We have worldwide packages as well as Caribbean packages. So both packages mainly include major medical, and you also have the option to include dental and vision benefits as well. Currently with our existing plans, we offer life and accidental death and dismemberment coverage, and persons are also interested in maintaining those as well. So we go along the lines of the worldwide and Caribbean to formulate plans that best suit what our customers would need.
And that's based on the availability of services when you say Caribbean and international.
The worldwide plan would cover the mainland US, whilst the Caribbean would include the Caribbean countries, including Puerto Rico.
So if a person wants to go to Jamaica for treatment, that would come into the Caribbean,
the Caribbean plan,
yes. And if a person want to go to the United States, Miami, or that would come
yes, that would come into the
UK.
And again, it's sort of designed in such a way that you need to have supplementary insurance, but you can choose one of the 2 plans which best suits your pocket.
Well, that's what I'm trying to get to. And now most people usually go to the United States, for example, or the UK because they think the service will be the best or it will be better than the region.
Definitely.
Right?
That's what the perception is.
That's what the perception is. So when you have a plan that says a worldwide plan that is based on cost as well
Cost.
as quality of service.
Quality,
Yes, and
yes.
some increased scope of benefits as well. But the Caribbean plan would serve almost just as good a service because, you know, Panama and Colombia and those places do provide quality health care. You know. We've even had some, based on our research, even Anguilla and Cayman Islands. Plus you have, of course, Puerto Rico, you know, and Puerto Rico, a lot of BV Islanders use Puerto Rico, a lot of residents use Puerto Rico. The challenge, I think, for us, both NHI and insurance companies as a whole, is that you're absolutely right. Everybody wants to go to the mainland U.S., and it's not cheap by any means.
And it's not necessarily better than what we have.
Not
Yeah.
necessarily.
And speaking of that, this is probably a side issue. I don't know if how well you could speak to this from your experience as an insurance person, but are you seeing improvements in our quality here? Because I know we have a new facility, we have modern equipment. I know a lot of people have been extolling the virtues of the new developments. We got HEMA Health, where now you could get specialist access here instead of having to go and spend money to go to Puerto Rico and room and board and all the expenses with your family. So, what are you seeing from that perspective, from where you sit, in terms of improved quality in our service?
I would say that looking at the claims that we get from the health services, you can see a gradual increase. And perhaps that suggests that, you know, more and more residents here are using the hospital services. And you can draw all sort of conclusions from that. So I think that in itself says that people perhaps are getting a little bit more comfortable using the hospital facilities. Certainly there's been a huge investment by the government for the facilities, and I dare say it's perhaps one of the best facilities you'll ever see. I mean, Ms. Penn and I had a meeting recently with the CEO. The lobby area alone, you know, you won't think that you're at a hospital.
Yeah.
Definitely not.
Yeah.
You know, so signs of progress.
Well, that's great. I want to talk now, Ms. Penn, with you about policies, the benefits in relationship to NHI, and how the costs will amount to affordability. So I don't know, NHI, if I wanted to well, what options would I have? Let me stop trying to figure things out and just ask a question, right? Okay. What options would I have as a person with NHI wanting to improve coverage with Nagico?
Okay, I mentioned that we have major medical. This would cover stuff like any surgical expenses, inpatient care, your regular physician and specialist visits, diagnostic testing, specialized testing. We have coverage for dialysis, extended care facilities, physiotherapy. There's a lot of different packages that we offer in terms of the major medical benefits.
So now NHI offers those things as well, but
Yes.
you're offering
Above and beyond.
Limits above NHI limits.
So once you've exceeded the limits that NHI has offered, then the Nagico plan will kick in to provide the additional coverage.
Okay. And what kind of costs are we looking at? Is this figures that you could give at this time? Okay.
I think I want to spend.
Okay.
I would say, look, we have looked at some of the groups, and we have come up with numbers like just about 120, as much as 100, and maybe 60. A lot of it depends on the group. The group claims experience. What we have seen is that the bulk of the claims seems to be local claims. So if that trend continues, we will be able to then offer the supplementary policy at a lower cost. In the initial year, there'll be some level of uncertainty because we don't know what the claims are going to look like. So I think there is room for further decrease if the experience is good. Well, it's a little bit early, but I'd say within this 4-6 months, we would have a good indication. I mean, at the end of the day, we want to be able to offer this policy to the entire Virgin Islands. We're the second largest provider for medical insurances in the BVI, and we are only second to Bupa, which has a government employee plan. If not, we would have had. And I think had it not been for the implementation of NHI, the Nagico medical policy would have grown by leaps and bounds. It was the fastest growing portfolio we have in our book of business. And the idea is to make it easy. We have a lot of the information already. We've been doing this for a couple of, maybe 5-6 years, and I think we've perfected it. And we have great access,
Okay. So let's say, for example, that I wanted a total package, and I have NHI. I would be able to conceivably pay for NHI and a supplementary package at a lower cost than I would have to pay for a total, say.
I think it varies.
Private insurance
it
package.
varies from based on your salary, your income. But generally speaking, it's going to cost a little bit more. But I don't think it's not significant enough to say you can't have both. I think it will come down to a choice. Some people might decide, I am perfectly comfortable with the National Health Insurance Plan and I don't need supplementary coverage.
Right.
And there'll be others who will say, I definitely want to have a supplementary policy.
But the options will be more affordable to have both. It depends on your means.
Yes, definitely.
Right? So
and we've priced it right, I think, for the market.
So the poor would be able, for lack of a better word, the poor would be able to have great coverage with NHI, and the rich would be able to have.
Well, I don't know if I want to put it like that.
Well, those who
in terms of the rich, but I think people, different people assess their own risk exposures differently, and some people might decide, I would like to ensure with absolute certainty that I have this overseas care to go where I want to go, and those persons might be prepared to say, I'm going to spend the extra money for that comfort. So it will come down to a personal choice. Plus, the ability to pay.
Right.
So it's a combination of both.
Yeah.
But I think that, we want to reiterate the point that we recognize that it comes down to affordability as well. And there's no point offering a product that people can't afford to buy. So we've taken those factors into consideration to arrive at our final numbers.
Okay. There's some concerns about co-payments, particularly in outside of the territory, where there may be, people might want to access doctors that are not in the network. And even those doctors that are in the network, a copay could be quite high depending on the illness. Is that something that you take into account?
Our policy will pick up the difference, definitely. Definitely pick up the difference. Because in our supplementary plan, we have not created any copayments. Okay. Because we have taken the consideration that you already have a copayment on the NHI plan, so there's no point in having two copayments. So we've taken a lot of things. I'm glad you're asking these questions. It allows us to share with the general public that we have considered in all aspects. So, the idea is that you don't necessarily have to go in your pocket to pay anything different for healthcare if you have, a supplementary plan and, the NHI plan.
So is it reasonable to expect then that the insurance industry there's a space for the insurance industry to compete where there might be a increased market in the areas where persons wanting who know with NHI would be able to afford private insurance as well. So if I have NHI and I'm paying $150 for NHI, I might be able to now afford a $120 plan just to put I figure my risks I might be able to afford a $120 plan and pay $270 for insurance with the coverage that I need personally based on my means, which ordinarily I wouldn't have been able to afford if it wasn't for NHI. So doesn't that sort of like increase the market a little bit?
I think that it's early days yet. And I also think that to a large degree it is not necessarily going to create an increased demand for supplementary insurance.
Okay.
I don't think it's going to. But I think that what the insurance industry will offer will certainly complement what NHI is offering. And there'll always be a segment of the population that can afford to carry both policies. And that is our hope, that both sides can thrive, taking those factors into consideration.
Okay. Well, we finally during the clock. The time has gone so fast, But I just want to ask you, Ms. Penn, if there anything that I neglected to ask you about your policies that you would like to specifically talk about in the time that we have remaining.
Well, like you said, the time already left us. So what I can do is ask persons to contact myself at Nagico if they have any questions or if they would like to get more information on what our plans offer. Like I mentioned before, we're focused on major medical, dental, and vision benefits, and the plans are basically designed to pick up the gaps where NHI falls short. So you can reach myself at Nagico in the medical department. The telephone number is 494-6433, extension 1. Or you can reach me personally on 340-1271 with any questions or concerns you may have. We are open to doing presentations on our plans in order to provide additional information where needs be. Okay?
Well, thank you very much.
All right, thank
Ms.
you.
Penn and Sean, thank you for coming by.
Thank you very much for allowing us to share this information as well.
Yes, it is important. Yes, you heard it here on Spotlight. Nagico Insurance has some plans available and has made a commitment to supplement the National Health Insurance, work in partnership with the National Health Insurance to make sure that we can afford the coverage that we need. I think it's a really, really great development and a commitment, a usual commitment on the part of Nagico to the community and the families of the Virgin Islands. And I want to thank you personally for that, Sean. Yes. We're going to take a break for a word from our sponsors. And when we come back, we're going to talk to Dr. Natasha Fred, Dr. Anil Solar, and Dr. Christian Ugwaugu. Yes, I'm going to get it before the night is over. About childhood development and health. And this is very important. I don't want you to go anywhere. We need to know that when a child is about 2 years old and wants to touch everything, how you need to deal with that situation. You can't beat the child down to the ground. Keep it locked right at the Spotlight. We'll be right back after these words from our sponsors.
Spotlight is brought to you by Tortola Concrete Limited, the National Bank of the Virgin Islands, and CCT Global Communications.